So welcome to this session. It's regarding the Therapist Assistant Diploma Program. My name is Daryl Skinner. I'm an instructor in the Therapist Assistant Program here at Okanagan College. And I'll be just leading you through a little bit of a session to find out more about that program. As I mentioned just briefly, when we're off the mic, this program trains graduates to be assistants to physical therapists, occupational therapists, or recreational therapists. So our graduates are really versatile and they end up working in a variety of different settings. So what I'm going to do first is try to share a video that our students did last year, I think it was. Two of our second year students who can explain a little bit about the program in their own words. So hang on here, we're gonna try and share this. Okay, it's not pulling it up for some reason. Just give me one moment here. Ah, got it. Sorry, I'm just gonna have to open up one other box. Just give me a moment. Sorry, I'm just finding the video. I thought it was cute. Okay. Okay, let's try this one more time. Just want to make sure you're getting the audio. Okay.
You can work under a physiotherapist, an occupational therapist, or a recreation therapist, or do all three, and do anything from run programs to run exercises to help educate people.
Are you hearing this?
Get them back to work or get them back to a regular life.
I'm really glad I chose to take this program at Okanagan College because not only do you have professors who are actively practicing their profession and you have wonderful theory-based classes and hands-on labs, you also get to participate in the original school that started it. They started this and they're accredited. That means you can take this anywhere in the country. What people don't know about this program is how much growth you get to do as an individual. You get put into situations that you would never have considered before. You get to learn about things that you would take for granted. How do you interact with somebody in a wheelchair? How do you react in a stressful situation? There's a new level of humanity that you develop.
We are so well prepared when we go out into our practicums. My first practicum, I was really nervous, didn't know really what to expect, even though I had all of these skills. But once I was there, I almost felt like I had more in my knowledge skills than I needed for that practicum, which was really, really, really good feeling for me.
So for students, there's a lot of options, and you can work in hospitals, long-term care. You can work in private physio clinics. You can work with people who are coming off work injuries. You can work out in the community. You can work with people with mental health issues, addictions, you name it. There's a lot. There's somewhere out there in the health field for everyone in this program.
Yeah, I think there's a huge demand for students, even just looking on the job market after this program. There's a variety that are needed, and it's because it's such a new area. A lot of therapists are coming to terms with, oh, maybe having an assistant will be really handy. And because it is so new, it's a growing area, and we'll continue to see that growth, which I think is really exciting and offers so many different areas that need it.
Okay, just want to make sure, did you hear all that? You could just type it in. Okay, yep, everything's working. Great, thanks very much. Just hang on. Sorry about that. Okay, so what I'd like to do next is just show you a brief PowerPoint presentation. So I will just load that up. Okay. Now I don't think I'm going to be able to see your chat box while we're doing this, so just hang on to your questions. I can certainly answer them all at the end. So this is the campus. If you haven't been on the Okanagan College campus, this is one of our newer buildings. However, one thing that we're very proud of is we have a new healthcare building, which the therapist assistant program will be housed in. So with that, we're moving over there. Actually, we're in the process of moving there. We're packing up boxes. So we're going to be over there after Christmas, and it's a nice new modern lab, new classrooms, and we're really looking forward to that. So this program appeals to people who are interested in healthcare. So sometimes they don't know exactly what area of healthcare, but they know that they like working with people. They want to try and, they're usually quite compassionate, want to help people, and they like working with people of different ages. So a person will be working with a team of professionals once you graduate. You'll be working usually with a health care team and spending your day making a difference. So the therapist assistant diploma program is a 2-year diploma, which means it has 4 full-time semesters. And there's also 18 weeks of clinical experience, what we call practicums or preceptorships. So you get to practice the clinical skills that you've been learning. So our graduates are well trained in 3 different disciplines. They are assistants to occupational therapists, physical therapists or physiotherapists, and recreational therapists. We're the first program in Canada, which we're proud of. We're over 25 years now that we've been running the program. And we're the only program in Canada that I'm aware of that have the recreational therapy component. So what is rehabilitation? We're always striving to help a person attain their fullest physical health, mental health, social, and sometimes work capabilities. You're going to be working, a graduate would be working with all different ages and different medical conditions. We cover what's called orthopedic conditions, which are just conditions of the moving parts of the human body. Neurological impairments such as strokes and head injuries, spinal cord injuries. Diseases associated with aging, developmental delays like cerebral palsy or autism. Some of our graduates have gotten employment recently at child development centers, and mental health problems as well. Just a little bit about each profession. Physiotherapy, I think we're known as the people that prescribe exercise. We often use electrotherapy, which is like ultrasound, interferential, those kind of machines. But if you've ever had an injury, you might have had that. And we're always trying to improve somebody's level of function and independence. Occupational therapists are more concerned about what we call activities of daily living. So they are more concerned about, can a person get dressed? Can they cook a meal for themselves? Is there a job that they can do? Those kind of things. So they're looking more from the functional consequences of an injury or disease. Recreational therapists, they like to be the people who add fun to the person's program. So they look at the leisure activities that people do and try to use leisure activities in a therapeutic manner. Where might a therapist assistant work? They can work in hospitals. So these are all the different, basically, wards of the hospital. Medical surgical, so after somebody's had a total hip. Orthopedic can be sprains and strains. General rehab, psychiatry and mental health, and they can work in either an inpatient or outpatient environment. They can also work in long-term care, palliative care, assisted living, adult day programs. There's a variety of places that the graduates find work, and it seems to be forever expanding. Community care, working alongside a physiotherapist or an occupational therapist. They may be going into a client or patient's home. So basically, wherever you might see a therapist working, you will often have a therapist assistant. Sorry about that. Child development centers, as I mentioned, can be in a school or it can be in a child development center. And private practice is a growing area. Several of our graduates last year got employment in private practice in physiotherapy. I'll let you read this yourself. Basically, what it's saying is that our supervising therapists, like who supervise students on their practicum, are very impressed by the training. These are just some pictures from classes. The two students on the right sitting on that bed there are probably doing recreational therapy. The student on the left there is working on wheelchair maintenance. It's part of OT, occupational therapist. Okay, so that's what a therapist assistant might be doing once they graduate. I'll just talk about the courses that are in the program. So this is the first semester. Semester 1 is what our students who've entered into the program are in right now. So they're taking biology, psychology, English, disease and disability, which is the course I teach, communication, and RTA. The ones in blue are called university transfer courses, or what we often call UT courses. It means that they can be used if you want to go on to a further degree. Those are often transferable to another institution. Then semester 2, which is going to be after Christmas here, students will start to actually do some practical hands-on skills. So that's what PTA 1, OTA 1, and RTA 2 is. And then practicum prep gets them ready to go out in May and June into their practicums. They get one 3-week rec therapy practicum and one 5-week PTA, means physiotherapy assistant, or OTA, which means occupational therapist assistant practicum in healthcare. And there they work under the direct supervision of a therapist. They can apply the knowledge and skills that they have developed on real patients. Students really love the practicums because it really becomes real once you start working with real patients with real conditions. So that's one of their favorite parts of the program, I would say. And then after that, you come back from your summer, you have semester 3, or at the beginning of second year. There's client care advanced, psychiatry and mental health. There's an anatomy course, more advanced labs in PT and OT. And then semester 4, just before they graduate, students have therapeutic modalities, as we talk about ultrasound and hot packs and all kinds of electrical equipment. PTA 3, which is advanced areas of practice, OTA 3, professional practice, and then a major capstone project. Then students go out for 5 weeks, 2 5-week preceptorships. These are areas in advanced practice in both occupational and physical therapy settings. If a student is in the program, they're going to watch us demonstrating, and then they're going to have a chance to practice themselves. And then, of course, when they're under the supervision of a therapist, they will get a chance to practice in a clinical setting. These are 2 of our students in lab. Communication is in any career, or any, certainly healthcare career or any career, is critical. Organizational skills are critical. Problem solving, professional behaviors and attitudes. You will practice in the lab, and then you'll carry those clinical skills over to a hospital setting. Okay, I will pull up, I might be able to pull this up if you want, but I can pull up the details of the mission requirements, but you can also find them at this link. So www.okanagan.bc.ca/TAD. There's another web page that we have. I would say, I mean, if you go onto the main page of Okanagan College, you can migrate your way to this page. And here's some more websites. Okay, I don't know if you pre-registered, you were already in the $5,000 tuition credit. If you haven't, if you just registered recently, you can go to okanagan.bc.ca/tuition giveaway, all one word. Okay.